Hi there, it's Dr. Cary. I'm a chiropractor in Kelowna, and today we're talking about back pain. We want to talk about what causes back pain, what I can do to help you as a chiropractor, and what you can do to help yourself. I have over 25 years of experience in chiropractic, and I've seen thousands of patients with back pain. And today we want to talk about the different causes that we've seen in the clinic. Everybody's different or unique, and so their background or their history is different. The diagnosis may be similar for patients, but then the treatment and the recommendations may differ based on that patient, how quickly they heal, and other factors like lifestyle. So today we want to talk about all those things. So what causes back pain? Most of the back pain we see is mechanical, meaning it's the movement of the joints in the spine. It's the way the tissues are working. It's the disc, the soft tissues around the spine, the ligaments, the muscles, and it's the nerve roots. So it's really mechanical in nature, how the body is lined up and how it's working. So we want to pay attention to that. There's nerve endings in the joints and in the tissues, and those nerve endings will send a signal to the brain when something's not working right. So the pain or discomfort is a sign that you should be paying attention to that area and do something about it. The discs can cause pain because they're like jelly donuts in between the bones. They are shock absorbers and they allow us to move, bend, and twist. So sometimes the disc can get squished and it can be bulging, pressing on a nerve. Or a pinched nerve, like nerve coming out of the spine on the left side or the right side can get pinched, and that can cause pain, even referred pain to different areas like the sciatic down your leg. Tight muscles can cause pain or discomfort. They can cramp on one side of the spine or get stretched on the other. And these imbalances can cause inflammation in the muscles. And arthritis, wear and tear in the spine, can cause discomfort, stiffness, pain in that area. So we see all of these conditions in the clinic. My first piece of advice for you would be to go see a chiropractor. So if you're in the Kelowna area, you can book an appointment with us. I'll give you the link and the code at the end of today's webinar. But really, you want to see a chiropractor to get your condition assessed properly. And then a diagnosis is made based on test results, based on x-rays, based on other neurological and orthopedic tests. And basically, we want to tell the patient what's wrong with their spine and how we're going to go about treating it. And so treatment could involve hands-on treatment, spinal manipulation. It can involve tables to help us do the adjustments. It could involve instruments like the activator. It could involve soft tissue work like shockwave or laser. All of those things to help the healing process in the area realign and restore function. And then we want the patient to get involved in the care. So what can the patient do at home to help themselves during this time where they're coming in for treatment, or longer term where we want them to maintain the improved condition? So some of the things that I recommend are ice and heat, or a combination of both depending on how long it's been there for and the condition of the tissues. I'll give stretches to patients to help the flexibility of the area. Fairly early in care, as the pain's reducing, we want to get a little bit more flexibility. Core strength, core strengthening to maintain the alignment and the changes we've made to the posture. So planks or bridges or these types of exercises to support the alignment of the spine. Ergonomics, changes to the workstation, the way the patient sleeps, the seat in their car, all of those things to help to get their environment to support better alignment and better function of the spine. And then lifestyle changes. And lifestyle changes like better nutrition and diet, more rest, more exercise, so more hydration or drinking water. So some of these things we want to talk about with patients so that long-term they have better health in general, not just for their spine or their back, but just in general, their health improves. If you're interested in learning more about my practice, often we do coffee with Dr. Cary on the weekend. You can go to our website, go into the event section, and then get a ticket for that. When we're doing the coffee with Dr. Cary The ticket gives you a chance to ask questions in the chat, and it's a little bit more informal, so we can cover a variety of different topics. If you're in the Kelowna area, you want to come into the clinic as a new patient, please use this coupon code 29OFF. It's good for a limited time, and all you have to do is go to our website, and it's drcaryyurkiw.com, and then go to the appointments section, and then when you enter your information, just put in 29OFF as the coupon code. That'll reduce the fee for you, and then we're going to send you the paperwork in advance to e-sign, and then we'll see you at the first appointment. So thanks very much for joining me today. If you have any questions about today's topic, please type them in the comment section. If you're interested in other topics related to health, please type them in the comment section. We're always looking to do webinars that could better educate the public and our patients. So thanks very much for joining us today, and we'll talk to you soon.